Hello, this is Dr. Haddad, the Chief of Staff at Blue Water Health. I'm pleased to welcome Dr. Tom Larcoix today, our Chief of Pediatrics at the hospital, to discuss school reopening, which is happening in about 3-4 weeks' time. I understand there's a lot of questions coming from parents and children and teachers as well. The focus today will be more on the children and their health and risk of going back to school. Dr. Larcoix, thanks for joining us today.
Thank you for having me.
I have a few questions. The first one is, what are you hearing from the parents in your own practice about the whole issue of going back to school?
So I think the biggest thing that I'm hearing from parents is that there's a lot of uncertainty, and I think that leads to anxiety. So, 80% roughly are saying that they're going to send their kids to school in the fall. But there are a lot of questions that they have. They wonder about what it's going to look like. How are things going to be done? What are they going to do with children who are attending kindergarten who have a lot of problems with social distancing? How are they going to manage to keep the masks on the children's faces? What is lunchtime going to look like? What is recess going to look like? So I think a lot of parents are expressing a lot of these concerns and looking for advice.
So what's your advice to the parents?
So I think the big kind of things that I think of is there's probably two different groups. There's the children who are under 10, and that's where it's a real challenge to get them to social distance and wear their masks properly and do all those things. But what we know from a lot of the research that's out there is that because of the way that young children's lungs are, they don't have a lot of the receptor that facilitates them getting infected from COVID. So in that kind of situation, you have a group who may be at more risk, but it's actually much harder for them to become infected. So across the world, when schools have reopened, they're finding that the more challenging group is the kids over 10 years old. And those are kids who, through the different measures that we do in the classroom and what we do at home with those kids, that's a group that we can affect change with things like social distancing, classroom setup, minimizing the number of classroom changes, and having kids wear masks. So I'm quite encouraged by a lot of what I've seen from around the planet.
What's your advice to parents or guardians of children who have pre-existing medical conditions such as asthma or diabetes or immunocompromised in any way?
So I think one thing is for everybody to be treated as an individual. Speak with your physician, have that discussion. If you have a child who you know is at higher risk and you're feeling uncomfortable, there's also the option of doing a delayed entry into the school system. So they have different entry points throughout the school year. Each of the school boards has identified times where you can switch from at-home learning to face-to-face learning or vice versa. And for some of my most at-risk children, I'm recommending that the parents at least take that first few months to let the school figure out what challenges they have and make sure that their protocols are working well before sending their kids into school. I think that's going to make it easier for parents, and it's also going to make it easier for the schools to deal with things as they try out their protocols.
I guess the feeling is that the school is a reflection of the community in a way. So it's our job as a community, as a collective, so teachers, parents, everybody else, public, is to keep the prevalence of the virus as low as possible in the community, which would protect the school system as well, isn't it?
Yeah, I think in various jurisdictions, what has been the best predictor of good success in school reopenings is that you have the lowest amount of COVID in your community. In some places where they've tried to do school reopenings with high prevalence, like in the US, things have not gone well. But in places like Quebec, when the prevalence was falling, we saw, even though they reopened schools, the number of school children who were getting sick continued to fall. So things went very well with the spring reopening in the schools.
So we, as all of us collectively, have to protect the children, the teachers, school system, just like we want to do with protecting businesses and reopening and prevent the second wave by still observing strictly all the various advice from public health in terms of social distancing, avoiding crowds, washing hands, mask indoors, all that stuff, right?
Yeah, and I think one of the most important things you can do is make sure that your children get flu shots this fall.
That's a great advice as well. Well, thank you, Dr. Larcoix, and we'll see how September goes.
Thank you.
We'll keep an eye on things.